Hello. If you are just tuning in through Facebook or YouTube, hello and good afternoon. We are very excited to have you here for our first ever town hall event of this year, which has been organized and supported by the Forsyth County Drug Awareness Youth Council. I'm Vinayak Menon. I'm a student at Lambert High School and the youth sector leader for the Forsyth County Drug Awareness Council. The title of this program is 2021 Facts and Strategies Concerning Substance Abuse 1 year into the pandemic. Throughout our community and really across our nation, substance abuse continues to be a pervasive and important issue that affects our youth. It's in our streets, in the hallways of our schools, and even in our homes. So it's truly essential that we as a community work together to find solutions to a crisis that impacts the next generation of Americans. This afternoon, you will receive input from experts and stakeholders as to what is happening in our community, how prevention efforts have been impacted by COVID-19, and our speakers will help direct you to resources for support. Our goal tonight is to leave you with a depth of information on our county situation and also answer any questions that you have. With that in mind, I'm going to hand it over to Saisha Kapoor, who is our Youth Council President.
Thank you for joining us today, everyone. We will be starting off this session with our guest speaker, Dr. Merrill Norden, who is an expert in psychopharmacology and addiction psychology. He is an Emmy-winning clinical associate professor emeritus of the University of Georgia College of Pharmacy and will be providing us with an overview of what exactly is going to be presented in this town hall. Next, we have our first panelist, Deputy Kevin Ferraro, who works at the Forsyth County Sheriff's Office and has 13 years of experience. He will be providing us with information on various types of drugs and how to identify them. Our second panelist is Dr. Justine, who works in internal medicine at the Northside Hospital. She has various amounts of expertise in vaping and will be providing her expertise along with information about the pandemic. Our third panelist is Catherine Rosborough, a mental health professional and the founder of Recovery Community Foundation of Forsyth, and will be providing us with her work in the community, especially our jails. Our last panelist is Victoria Ray, who is the Substance Use Services Sector Leader of the Forsyth County Drug Awareness Council and the head counselor of the Full Circle program in Georgia. She will be talking about recovery tips and along with youth information. All of the strategies our panelists talk about will be available in a PDF after each speaker talks and will be in the chat. Now, I would like to invite Dr. Norden to start off the event.
Thank you so much. I cannot tell you how excited I am about being involved with this town hall. I have been in prevention and have worked in treatment for 25 years. And now on my retirement day from the University of Georgia, I've made every effort to address prevention issues. And today is an extremely important town hall. As we titled it, 2021 Facts and Strategies Concerning Substance Use, 1 year into the pandemic. My job is to introduce our subject matter and also lead into our experts who will provide additional information as it regards to this very important topic. So let us begin. There's a dilemma of the collision of two epidemics, and if I really want to look at it, two pandemics. The two current public health epidemics in America today are, of course, the COVID-19 virus and the opioid overdose with increased development of substance use disorders and suicidality. My question, and I've done this several times, is what is your community doing to address these dilemmas? This town hall this afternoon will be an effort in order to begin the process of looking at our solutions in order to prevent further deaths amongst our young people as well as our adults in our community. By now, most Americans, at least it's estimated over 80%, have a basic understanding of COVID-19, but less than 30% have a basic understanding of the diseases of substance use. Prevention measures are being provided daily in your community about COVID-19. Most of you know about washing your hands and wearing a mask and social distancing and those types of things. But what do you know about substance use disorders and how to treat them and how to help individuals in the middle of this pandemic address the issue if a family member or a friend would develop a substance use disorder and need help. The current COVID statistics, this is March 1st, and these have unfortunately have increased since that day, is that worldwide we have over 115 million cases reported. We have 2.5 million deaths. We do have 90 million that have been reported to recover. In the U.S., we have now over 30 million cases reported. We have well over 525,000 deaths, and we have 20 million that have recovered. And according to the latest statistics, we have at least 9.5 million active cases. When we look at the coronavirus and the disease, the pandemic has a wide range of negative impacts on people that are affected by various health conditions. It is really a multifactorial virus. Among the hardest hit are the individuals struggling with substance use disorders, with the recent data indicating that suspected drug-related overdoses and deaths are on the rise in the United States. Some of the most grim statistics come from the National Institute of Health, and on a recent analysis of the nationwide surveillance collected by the Federal Overdose Detecting, Mapping, and Application Program, found that suspected overdoses rose by 18% in March of 2020, 29% in April of 2020, and 42% in May of 2020, as compared to those months in 2019. Another analysis of state and local mortality data shows that drug-related deaths have increased about 13% so far in 2020. What we has reported as recently as last month, there have been over 80,000 overdose deaths that have been reported, including 21 overdose deaths in Forsyth County. So as we look at those numbers, it is not encouraging. So what's happening that's creating these problems? One of the first things that we've heard from communities and families afflicted by addiction is that the support systems that were there to help people to achieve recovery are no longer present because of the social distancing, because of essential businesses only being allowed to open, and because of multiple other factors. These treatment facilities, support groups, access to evaluations have not been available as they were in the past. At the same time, it's much harder to get access to the treatment programs, including hospital emergency departments that really are the first step in a lot of individuals' cases in initiating treatment. It has been more difficult to access syringe exchange programs and programs such as Narcotics Anonymous and Alcoholics Anonymous that provide people with mentor and a social support system that is fundamental for recovery. Part of the recovery is also for individuals working to rebuild their lives, and that has become much more challenging due to the threat of COVID-19. In other words, it's face-to-face interaction of a recovering person helping another recovering person because of the social distancing and the fear of someone contracting COVID-19. Those opportunities have diminished greatly. All of these aspects are translating into much more stress. And stress, as most of we know, is one of the factors that leads people to relapse from a substance use disorder. Stress is also a factor that leads many to increase the consumption of drugs. We know that there's been a 35% increase in the consumption of alcohol. There's a report reported as late as today about nicotine and cigarette consumption has increased 15 to 20%. So we know that stress is being managed by the use of psychoactive chemicals. What are the risks of COVID-19 on substance use disorders? There are very many factors that are placed them at very high risk, pharmacologically, structurally, and socially. Pharmacologically, because the drugs negatively affect multiple systems in the body, and one of the main targets is the pulmonary system. A lot of the depressants, opioids, alcohol, the benzodiazepines, slow respiration rates and affect that respiration. COVID-19 affects the respiratory system primarily in its initial aspect on the body, so we have a problem with that. If your pulmonary system already has a pathology that has prior conditions, it is much easier for the virus to actually infect you and lead to a negative outcome. This pertains to cigarette smoking that produces COPD, pulmonary damage, individuals that are vaping, and we'll have someone talk about vaping here in just a few minutes, as well as the very toxic drugs like methamphetamine, which is on the rise, can create pulmonary hypertension, and the opioids, which actually depress respiration and causes hypoxia. You can see that the combination of depressed respiration and having a viral infection that attacks your lungs is not going to be positive. Indeed, it is very likely that the combination lowers the threshold for people to die from overdoses or even die from the virus itself of COVID-19. Drugs can also affect the cardiovascular system and the metabolic system. So all the factors that we've identified as conditions that make you more vulnerable to COVID-19 are affected by the drugs that we're going to talk about this afternoon. Stigmatizing individuals with addiction makes them even more vulnerable. So if someone has addiction, people are more likely not to reach out for them. That's because, first of all, they're afraid to seek help. They don't want to be discriminated against. Secondly, if they're in a situation where decisions are being made about providing medical care when resources are extremely limited, that stigma can also make them much more vulnerable. So we have a lot of underserved populations that are at risk of not only substance use disorders, but also COVID-19. While we're dealing with the COVID-19, we cannot ignore the disparities that exist in our society. This pandemic has made it very clear how horribly disparate health outcomes are between groups of people in our country. And we can look at various groups, if it be the Hispanic Latino population, if it be the African American, Asian American, Native American populations, which seem to be underserved in lots of health issues. The highest risk for COVID-19 complications include compromised lung function, which can put one at risk for those who have opioid use disorder or methamphetamine or other psychostimulant use disorders. Chronic respiratory diseases increase the risk for fatal overdose in those who use opioids therapeutically. In addition, slow breathing due to opioids causes hypoxia, and which can lead to a cardiac, pulmonary, or brain complications, and if severe, can result in overdose and death. At least 2 million people in the United States have an opioid use disorder, and more than 10 million misuse opioids. These individuals can be increased risk for the most adverse consequences of COVID-19. Methamphetamine is a highly toxic drug that causes pulmonary damage, pulmonary hypertension, cardiomyopathy, and also it's been marked increase, and it has a marked increase in the United States. Clinicians should be alert of the possibility for increased risk of adverse COVID-19 outcomes with methamphetamine users, which, as we will hear, methamphetamine is on the rise locally. When we have the risk of COVID-19, it's a risk of tenfold for opioid abusers. Study indicates recently that a substance use diagnosis has a higher prevalence for many conditions in the general population, including asthma, COPD, cardiovascular disease, and obesity. Now, all of those are high risk factors for individuals who may contract COVID-19 of having a negative outcome. So again, we have methamphetamine, we have opioids, we have individuals who are smoking and vaping. Much is still unknown, but it can be expected that people who smoke, vape, or use certain drugs will be at an increased risk for infection and its more severe consequences, and that strained healthcare systems and social distancing will present unique challenges for those who may also have a substance use disorder who are smoking and vaping. But the factor of stigma, smoking and vaping, and the use of opioids make this population one, if not the highest, at risk for contracting COVID-19, and the least group likely to recover from either COVID-19 or substance use disorder. And most people need to hear that. This is the highest risk to contract the virus and also the highest group to not recover from the virus. So again, a double whammy as a result of this. When we look at COVID-19 and isolation is difficult for anyone. And when we look at it, it depends on others for our well-being. The harder our situation, the more vulnerable we are if we don't have those support systems. One of the major concerns that we have along is not the erroneous risk of relapse in many people, but the risk of suicide, which is also up by 25%, which is always much higher in individuals who are addicted to drugs, particularly those who are addicted to opioids. Indeed, there's an increase in the number of suicides associated with the COVID-19 pandemic, including among people that are addicted. One of the elements that we're using to overcome is that virtual interaction like we are having now. They are fulfilling, and certainly for me, that's why I involve myself in these types of discussions in order to help someone out there in the virtual world that needs help, knowing that help is available. That's what we're about this afternoon. And when we've surveyed patients and families, we see how much the virtual support system are helping them. We see in many instances that this can be life-saving, really life-saving. For example, with telehealth, a physician can now prescribe buprenorphine, a treatment medication, without necessarily having to see the individual physically. There's a major breakthrough because it expands the number of people that can be treated. So you can provide buprenorphine, or you can provide support that someone with a comorbid mental health may need. It's not the same as physically being with others, but we have to recognize virtual technologies may enable greater equity in providing treatments. And this is so true. That's just one of the advantages of the virtual technologies that we have. As we talk about this in COVID-19 and substance use impact on the youth in 2021, I will say this in my closing comments. It's harder for patients to access rehabilitation treatment in various types of levels, if it be outpatient, stabilization, residential, or whatever. As a result, there's increased fatalities from the use of psychostimulant drugs, and there is an emerging methamphetamine crisis in this country today. Death from meth and cocaine are increasing about 7 to 9% in each year. Young people are facing hardships because of not only the social isolation that the COVID-19 pandemic has provided, but also overexposure to family members who may be unsupportive or abusive, and the lack of athletics and other healthy outlets. And so what some are beginning to do is they have access to nicotine, alcohol, and drugs. Among a study that was given among 4,300 adolescents and young adults nationwide who were surveyed, those who had ever used e-cigarettes was 5 times more likely to report having COVID-19, and those who have ever used both e-cigarettes and traditional cigarettes were 7 times more likely than have COVID-19. So one of the things is we're going to do this. So our today's town hall, as important as it is, as Saturday is very important for families, this is an extremely important time for families because we want to inform our community of the impact of the COVID-19 pandemic has had on our youth. Our local experts are from law enforcement, medicine, prevention, and treatment will share current statistics and strategies to prevent the harm to our young people from the consequences of both the COVID-19 pandemic and substance use problems. The purpose of the panel is to answer questions about what you can do to help our community save lives from the overwhelming destruction of this pandemic. So as I close, let us begin and have our panel begin to discuss their particular areas of expertise. Thank you so much for your time.
Thank you so much, Dr. Norton, for those excellent remarks and the information that you provided us with. We're going to turn it over to Deputy Ferraro to provide us with a bit more of a law enforcement angle and the current situation that's affecting our county.
Excellent. Good afternoon, everybody, and thank you for joining us at this important meeting today. I'm Deputy Kevin Ferraro, been serving here in Forsyth County for the past 13 years. Big passion of mine is coming out. I'm in Crime Prevention Community Relations Unit, and I talk to a lot of people in the community about different issues that we face on a daily basis, and of course, drugs is one of them. When I was asked to be a panelist on this panel here today for this town hall, number one, I was honored. But number two, I took that responsibility and accountability. I want to share with you what I see through my experience, what we're seeing out in our community. Because again, to tackle this issue, it does take the entire community. It's not just one segment, and it's a partnership. So it's the community and law enforcement and our peer coaches, our people in recovery. It's all of us working together for the common goal for the best of everybody. So when I was asked, first off, want to share a couple strategies that the Sheriff's Office is utilizing to combat the drugs or the drug issue that we have here in Forsyth County. Starting off, we love to educate. And again, I told you I'm out in the community on a daily basis. That's a big part of what my job is talking to folks. But I'm also in the schools. So if you have school-age children, I want you to know we educate in the school. So one of our first strategies that I'm going to talk about is our CHAMPS program. CHAMPS is the acronym for Choosing Healthy Activities and Methods Promoting Safety. So what we do is we partner with the schools. Right now, last year, we were in 14 elementary schools teaching the 5th grade. And basically what the CHAMPS program goes over is choices and consequences. We talk about alcohol awareness, tobacco products such as cigarettes or vaping, and the harm that it could do their body and their brain. It goes up through, and again, we have a lake community, so we offer water safety through CHAMPS. But again, it's a 13-week program where we're in front of 5th grade students for an hour a week, just explaining to them and educating them about choices and consequences, especially when it comes to drugs. So this is the evolved version of DARE. It gives us the opportunity to build long-lasting relationships with our students. If you didn't know, in Forsyth County, we are very blessed. We have a school resource officer, which is a deputy designated to every school in this county. So we are very blessed to build those relationships, and those are the teachers of the CHAMPS program in the elementary schools. So we're having a lot of success with it. The students love it. The parents love it. Big part of what I want to get across today with prevention is it starts with conversations at home. Parents do need to talk to their kids about drugs because addiction is real and it's a disease. This is hard to do for a lot of parents. So utilize your resources. If you have any questions, we have a great panel up here today with experts. But I want you to know the Sheriff's Office is always available. You could go and talk to the school resource officer at your child's school, or again, my information is shared today, I hope. And please do not hesitate to call me with any questions, issues, whatever it is. So that's an overview of our CHAMPS. The second item that I wanted to talk about in regards to prevention strategies is our drug takebacks. So as you're probably aware, the DEA does a National Drug Takeback Day twice every year, typically in April and October. Unfortunately, due to the pandemic, the October one was canceled, but we do have another one coming up. So what is the Drug Takeback Day, National Drug Takeback Day? First and foremost, what we're looking to do to try and combat drug abuse, especially prescription drug abuse, what we do is we accept any non-used medication that is not liquid. We do not take biohazard, but any pills that are in the home that families know they're no longer going to use, we want them to be disposed of. So we open up our precincts for a special day, National Drug Takeback Day, both at our North Precinct and our South Precinct. And we have people in the community bring by any unused medicine that they have no need for. So this is a huge strategy that we utilize to try and combat prescription drug abuse. As we get into my presentation in just a few minutes, we'll be talking about the escalation process. but pills is definitely a part of it. And a statistic that a lot of people aren't aware of is actually a lot of the overdoses, a majority of the overdoses in the United States are prescription drugs. So either it's mixtures or people overdosing, taking too much of actual prescription drugs that they're prescribed. And when I go and teach our students, our 5th grade and 8th grade students talking in the schools, they're taken back because they expect prescription drugs to be safe. And again, that's where the conversation, it starts with us, education. But then as a parent, it's important that you reinforce all the lessons that your child is being taught in school. So that's what this platform is. So those are the 2 strategies I wanted to share with you today that the sheriff's office is taking to try and combat, the epidemic of drug use in our community. So without further ado, I'm going to go ahead and also empower. Again, a huge passion of mine being in community relations for the sheriff's office is to empower and educate parents. I can't tell you how many calls I've been on where we go to a home, they're iffy if their child is using, and right as I walk in, I identify, and I'm going to share with you some pictures today. You could identify some paraphernalia or just odds and ends that definitely dictate that their child may be experimenting with drugs. So I'm going to go ahead and load up this PowerPoint, and we're going to talk about drug awareness for a minute on the parent side. So again, drugs of Forsyth County. This is not an all-inclusive list, but again, these are the top ones that we see almost on a daily basis here in Forsyth County. We are not immune. We are very blessed with, basically the lowest crime stats per capita in the metro Atlanta area. However, we do have the same issues as our surrounding counties, and drugs are no different. So the first and most important thing I want to say in reference to my parents out there is drugs do not discriminate. Unfortunately, there's a lot of parents who believe their kids are good students, they're athletes, so they'll never get involved in drugs. And I'm here to tell you, again, through 13 years of experience, that is so far from the truth. We have to wake up to reality. So this list right here, again, is not all inclusive, but a few things I want to touch on about what you could look for and what we see, why it's an issue, and what we could do to work together to solve these issues. So we're going to talk about alcohol, vapes, marijuana. We do have methamphetamine, but I want you to know the drug use is an escalation process. So most children, when they first try to experiment with drugs, they don't go straight to the hard street drugs. It usually starts off with alcohol. So you can see, why does it start off with alcohol? Well, first and foremost, it's very, very accessible to our children. So a lot of parents tell me they do not keep alcohol in the house. These pictures, again, exaggeration. But on a college campus, which my son is in right now, I could tell you that's not very uncommon to see a refrigerator like that at a frat house. So very accessible to our young people. But even in our homes here in Forsyth County, most families will have alcohol readily available in the refrigerator. They have wine in the wine rack, so they have their adult beverages. So even if you don't, I want you to know when your child's away from your home and they're at a friend's house, they may have access to alcohol like this. And again, it's just kids experimenting, not realizing the consequences that it could have when they start down this road. Okay, but again, alcohol is the most widely used drug amongst young people. So we need to combat it and educate our kids about the laws. Very important. So, and then here's another lesson for parents. You can see our alcohol, the businesses out there actually target our young people. So they flavor things like in this picture, such as Pop-Tarts. They have pictures on the cans, even the commercials. They entice the kids to make it look like it's the life of the party if they drink alcohol. And this is something we teach them during the CHAMPS program. But again, it's really important for parents to understand and reinforce at home that that's not reality. What they're seeing is enticement for them to purchase because, again, the alcohol businesses are out there to make money. So, again, they're out there enticing your children, and we need to just guide them to make better choices. This one right here, super important. Okay, next one, e-liquids and vapes. So I show these pictures for a couple reasons. First and foremost, again, to show parents that they come in all sizes, shapes, and forms, because again, this is another epidemic that we're starting to see in this country, the vaping. You'll hear a little later from another panelist all about the harmful effects, but I could tell you, again, I'm a dad, I have 2 teenagers myself. So I see it, I hear it through my work, in my personal life, and I can tell you there are so many parents who still do not understand how harmful vape products could be, or even e-cigarettes. So few points I want to make in reference to this. First off, see the pictures, and this is not all inclusive. These vaping products or e-cigarettes come in all different forms, shapes, sizes, colors, you name it. This is only a small sample of what we see. Bottom left is one of the most popular ones amongst high schoolers. It's called a Juul. So if you ever hear them mentioning a Juul, that's what they're talking about, is a vape product. But these products actually use a regular USB to charge, which is a heating element that turns the liquid into a vapor, which is why it's called a vape product. But again, parents will call me in and they say, well, I think my son or my daughter might be vaping. And we go into the room and this is in plain view. And a lot of the parents believe, since they do look like flash drives, they're not aware that this is a vape product, even though, again, it looks a little different than a normal flash drive. So it's important, again, to raise awareness for our parent population out there, what these products look like. But again, it behooves you to go out there and look on the internet to see, especially if you have an inkling or a thought that your child may be vaping. Because again, with drugs, it's an escalation process. With this one right here, one of the most addictive drugs found out there right now is nicotine. And unfortunately, these vape products have more nicotine, concentrate than if they were smoking regular cigarettes, which we have seen a decrease in when vape products came out in young people. And they believe it's a safer alternative, and we need to educate our young people that that's not true. Okay, a vape product was created to help people who are addicted to smoking cigarettes to wean them off of the nicotine in a slow process. It is not an alternative to smoking cigarettes to begin the process of intaking nicotine. So it's important that we work together to educate our kids in reference to that. Here's another problem when we talk about vaping. So most of the time, and I do say this out in public often, if it could be smoked, it could be vaped. Okay. And that's a majority of that is true. Well, in reference to this, your children know, number one, where they could go and get these type of products. But number two, in reference to this, what I have up on the screen right now, these are vape liquids that have the element of THC, which is found in marijuana, that gets kids high. Okay, so this is super important for parents to pay attention to, because again, I know some parents that allow their kids to vape because again, they think it helps them with their anxiety and everything else. But you have to be aware that again, in this situation, it could lead to the next level. It could lead them up from vaping into THC, again, which is a psychedelic drug that gets them high. It's an element where your child will alter the way their brain and body functions after using a product like this. So it's super important. And again, addiction is real. With the escalation process, this one right here, again, very most widely used illegal street drug amongst our young people. And again, controversial statement, but I'm going to state it anyway, is I believe, this is my opinion, Deputy Ferraro, that this is a gateway drug. Okay, so marijuana is the number one illegal street drug that we see being used by our young people. Okay, and there is a lot of controversial information regarding that fact. So again, I want to empower parents so you could know. A lot of parents that I talk to look for this picture right in the middle of my presentation right here, the marijuana leaf. Well, I'm here to tell you that is not what marijuana looks like when your child is smoking it. So we'll go to the next slide. That's the actual marijuana, which is the flowering bud that is picked from the marijuana, the cannabis plant. Okay, after it's bloomed, it's dried out, and then it gets grinded up and used in a couple different formats. Okay, so parents often ask, what does it look like and what am I looking for? And that's the reason for this on my presentation today. They could hide it in little small bags, you know, nickel and dime bags, which is the right picture showing it will fit right in the inside of your palm. You know, a lot of the times we do find it in half sandwich baggies. And these are users. I'm not talking about the traffickers, which are large amounts. These are our personal use users. Okay, those are the sizes you're looking for. So as parents, that's what you need to keep your eyes out for. But there are some tools of the trade that you need to be paying attention to also. So this is called a marijuana smoking device, 2 different versions. The top one is called a bowl. And again, I could tell you many times I've been out on talking to parents, counseling kids, and this is in plain view. But parents, again, almost hit that denial stage where they believe that their child is now starting to collect, you know, it's art, glass art, painted glass art, and it's displayed right out. And I'm here to tell you, some kids may do that, but this needs to lead to a conversation with your child, okay? Because this is a marijuana smoking device. Top ones are called bowls. The bottom ones are called bongs. But again, I'm here to educate our community, to let our parents know this is what a young person, and honestly, it's across the board, anyone who's using marijuana, these are tools of the trade that they use. These are little identifiers to look for to spark up a conversation. Super important that we talk to our kids so we educate them to help them make better choices, understanding the consequences that comes along with using. Here's a few more tools of the trade. So you can see I pulled this right off of Google, top left. So you got rolling papers, you got your blunt, which is a cigar that they actually take out the tobacco and fill it in with marijuana, okay? To the right is a grinder. So I want you to know these comes in all shapes, sizes, colors, you name it. So this is just a picture for you to get an idea of a tool of the trade. And what they do is they take that flowery bud from the last picture, the flowery bud, they take that, they put it into the grinder and grind it down. This way they're getting all the leaves. On the bottom right, that's the remnants that they throw away. That is the seeds of the marijuana, the stalks of the plant. That is not what they smoke. They want to smoke the dried out flowery bud, okay? Some users have told me the seeds cause headaches and other stuff like that. So they do try and extract it, and the grinder is a way they do it. Last but not least, pretty common of what we find, if your child is frequently when you're doing their laundry or again out in the middle of their car, if they're of driving age, if you see them using Visine, this is again a way that they disguise their use, because again a side effect of marijuana use is bloodshot eyes, and your children know it. So how do they hide it? They go out and buy a cheap bottle of Visine, they keep it on them, they put it in their eyes before they come home. This way, if they have a conversation with you, they don't look like they're high. So it's important that, again, I'm not, and make sure that I'm clear here, I'm not saying everybody who has Visine just smoked marijuana. That is not what I'm saying at all. But again, if your child has it, and again, they don't have allergy issues, it's not allergy season, whatever is going on, you know, if they don't need eye drops and you're finding them with Visine, it's important to spark up the conversation, because again, this is a telltale sign that they may be using. Again, our goal today is to spark up the conversation amongst our young people so we could educate them about the consequences leading up to addiction. Okay, super important that we do this together. So those are the tools of the trade. And now let's talk about how smart and creative our children get. So these are actual pictures from Forsyth County. and with social media readily available to children any age who have internet access. So you can see these are marijuana smoking devices. I usually get laughs at this in person, and with virtual, it's a little different, not seeing my audience. But again, top one, you can see they just poked a couple holes in a soda can. This way they could burn the marijuana up top. They let they poke the pen through the side to create the hole where they're going to inhale the smoke, and that's becomes a smoking device. And I say for marijuana, I want you to know if it's a drug, an illegal drug that they're smoking, and also kids do smoke pills, just so you're aware. This is a device that could be used amongst a lot of different drugs, not just marijuana. Definitely need to spark conversation if you're finding paraphernalia like this. So burnt soda cans, the smart bottle turned into a bong, the apple, pretty ingenious right there. So he took a piece of fruit. This was actually in a garbage can, I want you to know, and the parents just thought it was a rotten apple, until their child wasn't acting normal. They called us out, and yes, this is really an item used to make a smoking device. So very important that you understand. And bottom left, he turned his Nintendo 64 remote into a smoking device because he's able to hide it in plain view from his parents. So unfortunately, I'm running out of time, but I want you to know we present these types of presentations throughout the community on a monthly basis. With COVID, it's been a little different. So with the pandemic, we're virtual. Hopefully we start in person really soon. But again, please utilize the sheriff's office as a resource. This last one, the synthetic marijuana, very important for parents to be aware of. So this is a man-made element to imitate the high that our kids or users get when they smoke marijuana. Very, very, very dangerous because it's a whole bunch of different chemicals just thrown together. Readily available. Again, you could see this one is named Spice. In our county commissioners have done a great job putting in new ordinances that the sheriff's office could go out and enforce. But again, outside of our county, these are readily available in gas stations and different areas like that, and our children know it. So it's super important that you know what it looks like. Again, it's man-made, but everything it's made for is to imitate what the marijuana drug would do to your children. So again, I want to thank everybody for joining us today. My time is up, but again, thank you. If you have any questions, please do not hesitate to reach out to the sheriff's office at any time. We are here as a resource to serve this community. We do not just lock people up. We are here to help in any way, shape, or form. Thank you so much.
Well, thank you so much, Deputy Ferraro, for that presentation and all the work that you're doing in our community. I'm going to go ahead and turn it over to Dr. Justine to give us a public health perspective on the situation that's affecting our community.
Hi, thank you for having me. I am a physician at Northside Forsyth. I practice internal medicine and hospital medicine. I take care of patients in the hospital with COVID. I've taken care of friends with mild symptoms of COVID with advices. And I'm also a medical director at a hospice facility. And I've also taken care of patients that regretfully have had to be transitioned to hospice care because of COVID. So I've seen the whole spectrum of COVID. And today I'll be talking about COVID-19 and substance abuse. So we've all, with this pandemic, we all have heard a lot of studies, media coverage on the medical complications, but there's only very few studies that are addressing the potential effect on the mental health of COVID itself. So today I'll try to address some of that. So even short, we've all lived through this, and we know that even short periods of isolation and loneliness can have negative consequences on the physical and mental health well-being. The feeling of isolation can lead to anxiety, anger, sleep disorders, depression, post-traumatic stress disorders, and these can be underestimated during the pandemic because of lack of specific screening tools during this time. In addition, prior to the pandemic, I found it difficult to refer patients to psychiatrists. It was very difficult to get appointments, and now it is even harder during this pandemic to get psychiatric assistance and to go see a psychiatrist. Studies are showing that people that are addicted to drugs that use prescription sedatives available at home may have now shifted to narcotics such as new synthetic opioids or designer benzodiazepines that are available online. These two classes of new psychoactive substances, the new synthetic opioids and the designer benzos, actually showed the highest consumption increase in 2019. During this pandemic, we've all been going through anxiety and fear, not only for our health, but also for our jobs. We are having to live, and we're forced to live in this unfamiliar lifestyle, deprived of relationships. So this odd situation may have pushed more people toward deviant behavior that is linked to illicit and illicit drug use, drug substance abuse. And this has probably been a good opportunity for drug dealers to attract new customers. So here, there's actually two studies that I found that investigated COVID-19 patients and mental health. And it was found that high level of post-traumatic stress syndrome was found in 96.2%. And a significantly higher level of depressive symptoms. So they found that patients with pre-existing psychiatric conditions reported worsening of these psychiatric symptoms. Studies investigating healthcare workers found increased depression, depressive symptoms, anxiety, psychological distress, and poor sleep quality. Studies of the general public revealed lower psychological well-being and higher scores of anxiety and depression compared to before COVID-19. So a variety of factors were associated with this higher risk of psychiatric symptoms and psychological not feeling well. And these it was more common in the female gender, in poor self-related health that had prior conditions that predispose you to worse outcomes, and relatives of COVID-19 patients. What I found interesting that I didn't even realize could happen was that in some areas of the country, there was a lack of classic drugs due to border closures. Also, the impossibility of being able to go out to look for these drugs, the dealers not being in their typical places because of the shutdown of bars or nightclubs. This actually induced people that are addicted to drugs to misuse psychoactive prescription drugs such as benzodiazepines. There's right now limited scientific evidence, but the impact of COVID-19 pandemic could lead to a substantial modification in substance use patterns and an increase in risk of substitution, adulteration, contamination, and dilution with potentially more harmful substances. So in addition, in this period of home confinement, users might no longer be looking for socializing substances to be used in recreational settings, because there's little recreational settings, but now they're looking for psychotropic drugs to be consumed in solitude. So due to all these factors, we may see a change in drugs of choice. So we must familiarize ourselves on how to prevent this and how to deal with these new patterns of drug abuse. We need continuous operation of drug treatment services, including continuous supply of substitute therapies and other essential drugs. and the implementation of contingency plans to address any shortage of therapies and tools. For example, before the pandemic, patients receiving methadone had to follow a specific approved treatment program for opioid addicts, under which the drug was closely monitored and it was administered daily under supervision. This may not be possible under pandemic precautions and the public health current guidelines. So we need to find ways to administer this to patients where if they're reasonably stabilized, we should be able to give them several doses of methadone in sufficient quantities for several days, or refill their buprenorphine prescription over the phone. We need to find ways to do this under pandemic circumstances. The public community should also focus on efforts of development of virtual meetings for people with psychiatric illnesses. And so we're seeing, I easily went online and I found quickly you find ways to buy and purchase drugs such as cannabis and others. And they're actually, they can be delivered through private couriers to your door. And that's just all very scary. Let me skip this. So overdoses, I did find 2 studies. In Virginia Medical Center Emergency Department, they saw 123% increase in non-fatal opioid overdose between March and June 2020. And that was in comparison to the same months in 2019. A report from Johns Hopkins Bloomberg School of Public Health titled Saving Lives from Overdose During a Pandemic collected data from North Carolina and Arizona, and it showed a 15 and a 35% rise in opioid-related overdoses between March 2019 and 2020. So let me get to the next. So So due to all these factors, like I said, we can see, let me go back to this, a shift in pattern. And we need to prepare ourselves in order to address these problems, especially if the risk of having another pandemic within the next 2 years to 15 years is high. There's many reasons for that. So we should use this pandemic as the learning ground on what we can do to address all these issues that are going to become more and more relevant and important in future pandemics. And we should learn from from our current situation. I was also asked to give 2 strategies for prevention. And number 1, prevention, prevention, prevention. That's my motto. It's easier to stop substance abuse before it starts than to stop it once it's already happening. And that, like the other speakers mentioned earlier, it's important for family time, talking to your kids, dinner time, things like that. But what I found, what I've learned with my kids, I have 3 children, is that sometimes we expect them to tell us at our time when we want to talk to them in our situations that we feel comfortable with, maybe at the dinner table or in the car coming back from school. And that's not necessarily the case. Maybe that's not the time they're ready to talk. They don't feel comfortable. It's not their time to open up. So, for example, if you have a child that likes playing video games, you could go up to them when they're playing video games and you sit next to them. Within 10 seconds, they're going to start talking to you about everything they've built, everything that's going on in the video game, who they're playing with, and they're going to tell you all these interesting things that you will even enjoy watching them play video games. And during that time, they'll open up more and you can sneak in questions that you're interested in. So I recommend, my strategy is talking to them on their time, on their terms, not your terms, not when you're comfortable, but when they're comfortable. My second strategy is kids are watching us. They can see what we're doing and they're taking notes. They will not do what we tell them to do unless they see it they see us doing it ourselves. Our sons and daughters are smart enough to realize that when our words contradict our actions, they can tell. So be a role model. It's hard. You can't tell a kid not to try alcohol when you're maybe overusing it or it's accessible in your home. We saw those pictures that the sergeant had up. Don't have a stocked fridge with alcohol. It's a temptation. Kids' brains aren't fully developed until the age of 25, some even 30. So and the frontal lobe takes up to all that time to develop. And the frontal lobe is what gives us certain adult personality traits. Kids are more risk takers. They won't think about consequences. And that's because the frontal lobe is not developed. So you put something out there like an alcoholic beverage or a stock full, bar, they're going to take the risk. They're curious. They see parents doing it and they're risk takers. Their frontal lobe is not developed. So let's not put these temptations out there for them. And let's us be role models. They're not going to do what we tell them to do. They're going to do what we tell them to do if we're also doing it ourselves. So those are my two strategies for prevention. I had, let me see, maybe I can go back to this slide. I know that Dr. Norton spoke about suicide rates, and I'd love to have that study that says 25% increase. I couldn't really find anything on suicide rates. What I did find is that it's too early to say what the ultimate effect of the pandemic will be on suicide rates. And data so far, it's a complex picture. It just depends what country you live in, what socioeconomic status you're in, what the health of the community is, social support, family support. There was actually numbers that in the beginning of the pandemic, which was called the honeymoon period, where there was families joined together, the community joined together, and everybody wanted to work together, there were actually decreased rates of suicide. But once that honeymoon phase was over, the suicide rates increased and they started catching up to prior years. I did find one important study from Japan that did find an increase in suicide rates between certain periods of the year of the pandemic, but that was only in Japan, and it's hard to compare Japan with Haiti, with the United States. It's even hard to compare Georgia with how quickly it opened to maybe somewhere like Massachusetts, that still all the students are still online. So it's difficult to compare. And then maybe in the future, once more numbers come up, we'll know a little more about that. But maybe Dr. Norton could also talk a little bit more about that, because I definitely am not an expert on that. And thank you for having me. I'd love to talk more, but I want to give some time for the other speakers. If you have any questions, I'd love to answer them and have an open discussion about anything. Thank you very much for having me. And thank you to Vinayak and Seisha. I'm honored to be here. And not only because of the topic, but because this is student youth driven. And thank you for all your hard work.
Thank you so much, Dr. Justine, for all that important information. The pandemic has affected our community in so many unimaginable ways. And we thank you for all you've been doing on the front line and some of the advice that you're giving to families. We're going to be turning it over to Mrs. Catherine Rosborough, who's going to provide us with some input on mental health and recovery.
Hi, good afternoon. I'm happy to be here. My name is Catherine Rossborough, and I am a woman in long-term recovery. Back in 2013, I had the gift of being able to go to treatment and start the recovery process. So I am here today to share some local resources that we have and to share the hope of recovery. Right now, there are about 25 million, probably more by now, people who are living in long-term recovery. And we're seeing some positive things in the recovery community, even throughout COVID. So as Dr. Norton pointed out, COVID-19 has presented some, unique but extra stress among people who are in recovery from addiction. However, we're seeing our phone is beginning to ring. People are beginning to come back out. But during the time that that we were in shutdown, and we went to virtual meetings, an interesting thing happened. We saw a lot of people who were attending meetings who previously could not attend meetings because they didn't have childcare or they didn't have transportation. We saw people from all over the country dialing into meetings, so then there were access to all different types of recovery meetings virtually, literally 24 hours a day. So that's kind of on the flip side of the isolation. Virtual meetings are not the same as meeting one-on-one, but for some people, particularly people who are a little shy or early in recovery, just to be able to sit in on a meeting and turn that camera off, offer some level of safety and anonymity. So we have been seeing that. We're also seeing an increase in people walking in and asking for peer coaching. And I'm going to talk to you about the Recovery Support Center that's available here in Forsyth County specifically. So back in 2016, I had the pleasure of starting a nonprofit. It really came out of my recovery story, but a group of us, it was a very grassroots movement, and we started an organization that's called the Recovery Community Foundation of Forsyth, or RCFF. We're all peers in recovery, and we're all trained as certified peer specialists, so we are actually certified recovery coaches. And then in 2018, on a grant through the state of Georgia, we were able to open the Connection. The Connection is located at 608 Veterans Memorial Boulevard. The county commissioners actually are allowing us to use the space that we're in free of charge. So the question is, what is a recovery support center? Exactly what it sounds like. We are a group of peers in recovery who offer supports in the form of meetings. We have all kinds of recovery meetings. We offer one-on-one peer coaching. We offer family supports. So anything, we're kind of a hub and a resource for all things recovery. The mission at the Connection is to empower recovery in Forsyth County. And so some ways that we fulfill that mission. As peers, when people come in, no matter where they are on the recovery scale, if they're contemplating quitting or if they've been in recovery for months or even years, we can share our lived experience. It's kind of like people who maybe go and fight in a war together. You can't really understand what it's like to have had an addiction, we believe, unless you have some of that shared and lived experience. So we listen without judgment, first of all. Also, we come out and share, as I'm doing now publicly, our stories of hope, that we do get better. There's good news. As I said, there's 25 million people in America right now who are living actively in long-term recovery. So we share our stories to address the stigma, which is the number one barrier to getting treatment. The stigma of having an addiction, that somehow we're broken or morally bankrupt. And we educate people about the process in the brain and how addiction actually affects the development of brain and why we see some of the behaviors in people who are addicted that we see. And we also respect multiple pathways to recovery. So what that means is there are as many pathways to recovery as there are people in recovery. So some may choose a 12-step program. Some may choose what we call SMART recovery, which is a cognitively based program. We have, there are folks in the community who do medication-assisted treatment, Buddhist-based meetings, book clubs, yoga. There are lots of different ways, churches and faith-based pathways. So anyone in recovery on any pathway is welcome at the Connection. We also have fun social events, which I think is, that's one of the things that gets lost, or when people come in early in recovery, they think, oh, I don't really know how to have fun without drinking, or I don't know how to have fun without being high. So we provide free, fun family events in the backyard in ways to create together, having fun, Super Bowl parties, 4th of July parties. Anytime there's a holiday, we like to provide a social event. Okay, so some frequently asked questions, and here are some of our volunteers. We have a large volunteer workforce, over 200 volunteers. They were here on a Saturday getting some work done, but some common questions. What is a recovery community? So a recovery community is actually made up of people like myself who are in recovery, also our families and friends, because addiction is a family illness and recovery is a family process, and also our allies and community partners. So the recovery community is not just people in recovery, it's also the people in our lives and community partners that support what we do. Are you a 12-step clubhouse? We are not a 12-step clubhouse. I mentioned multiple pathways to recovery. We do offer some 12-step programs, but we offer much more than 12-step meetings. Do we do counseling or treatment at the connection? We do not do counseling. We are not trained clinicians, so we do not offer counseling. We offer peer coaching through certified peer specialists, and treatment. What we do is not treatment, it's really post-treatment. So a lot of times people think, well, my son, my daughter went to treatment, so they're better. What happens in treatment, we hope, is that recovery will be initiated. And so then recovery supports and recovery happens over the rest of your life once you leave treatment. So we don't do counseling or treatment at the connection, but we do offer long-term recovery supports. And statistically, what we've seen is if we can get a person to remain connected to a sober community and to maintain long-term recovery for 3 years, then the rate of relapse and recidivism goes down to below 20%. Whereas if once a person, the first year is about 80%. So then over a 3-year period. So the longer that a person stays connected in recovery, the less the likelihood that they will relapse. How much does it cost to come to the connection and get our services? All of our services are offered free of charge, paid for through a grant. We accept donations, but there are no fees for services for anyone. And what supports are available to our peers with mental health challenges? So while we do not do mental health counseling, we work closely with mental health providers, but we have peers in recovery who are certified not only in addictive disease, but also in mental health. So we offer free peer coaching by a peer with lived experience in mental health challenges. Tammy, could you?
So there's a saying, if you have a forest of sick trees and you take one out and you nurse it back to health, you put it back in the same forest, it will get sick again. You can't expect it to thrive back in a sick or damaged environment. So making connections with other people in the community that have the same goals as you, that have the same mindset of improvement and longing to get better, and the commitment to do that is just crucial.
What we do here at the Connection is actually look at recovery as opposed to sobriety. The problem of addiction is that people are isolated. I was isolated, so I became addicted. The opposite of that was leaving treatment and realizing that I needed a community. In order to get better, I needed a community to live in and to stay better.
Treatment is like going to the emergency room. Recovery is what happens after the first triage. After the operation, you go into recovery. Recovery is what happens when you assimilate into real life, into the rest of the world, comfortably. And what community does for you is that we share the trauma of the dark days. And we all have that common experience. And we've all speak a language that's unique to people that have had that experience.
So the Connection is a recovery community organization. We are run by people who are in long-term recovery, serving people in recovery. It is a place that you can walk in the door and feel welcomed and lifted up and empowered, and hear stories of hope from other people who've been exactly where you've been. We're here to serve Forsyth County. So you can come here and get one-on-one coaching, and then we offer a variety of support groups that really promote any pathway to recovery.
It doesn't feel like a standard clubhouse. Like, this is more like inviting. You can actually tell people care here, where like other places like meetings and stuff like that you go to, you don't get that feeling. You don't feel like the outsider here.
One really big thing that's missing when people come into recovery is they feel like they've lost fun. And we want recovery to be fun. So we have Friday fun nights where you can come and just hang out with other people.
And speaking of fun, we wanted to create an annual event that engaged the entire community in celebration of the fact that recovery is not only possible, but recovery can rock. Our signature event, Recovery Rocks, features live bands, inspirational speakers, food, games, and a whole lot of fun for people of all ages.
We have a culture here of family, fun, and food. We're very family friendly. I got better, my family got better, so we get better in the context of family.
It's just really different to be able to connect with people and make decisions that impact my life with a clear head, knowing that there are better things out there. So I'm very hopeful about career, future, relationships, learning to play badminton. I mean, what else could I ask for, really?
So, why does the connection matter? Since we opened in September of 2018, we have served over 2,000 individual peers. And we have had people from all over the community. We have church groups come in, we have small businesses come in and perform work days and volunteer service hours. So over 5,000 volunteer service hours have been logged since we opened. I do want to tell you that we are having in-person distance meetings on Friday night. We don't have indoor family fun night happening right now, but we do have a fireside gratitude meeting on Friday night. So slowly but surely, some of the groups are coming back. We also are offering a variety of virtual meetings, but we are open for walk-ins and for one-on-one coaching currently. How you can help, if you want to get involved, spread the word that there are free recovery supports here in Forsyth County. You can volunteer. We still have volunteer projects and things to be done. We've been involved with food drives and coat drives and we've been to the hospital and try and create things for our healthcare workers. And follow us on Facebook and Instagram at The Connection Forsyth. If you go to our website, theconnectionforsyth.org, there is a calendar of events. We have events about 6 days a week, including our virtual meetings. So thank you so much for your time and attention. I really appreciate it. Oh, and please fill out the survey at the end of our presentations. We really need your feedback. So thank you.
Absolutely. The survey is incredibly important. I want to thank you so much for those remarks. It's so important for people in our county that are facing substance abuse to not be affected by stigma, but to be supported in all their capacity, to be provided all the resources so that they can truly recover and, like you said, get on a pathway to life. Our final speaker, last but not least, is Miss Victoria Ray, and she's going to be providing a recovery and a youth perspective on substance abuse.
Thank you so much. I'm so excited. Hi, everybody. My name is Victoria Ray, and I am the program director for the Full Circle program here in Georgia. And I wanted to share a little bit about my story as a young person that grew up here in Forsyth County and as a person in long-term recovery. and kind of tell you a little bit more also about what we're doing here with Full Circle. So, like I said, I grew up here. I graduated from South Forsyth High School in 2012. I have an incredible family. Went to church every weekend. Mom and dad were amazing. And when I was growing up, I really always had this feeling like everybody else in the world had something figured out about how to interact with other people or feel comfortable in their own skin that I didn't. And I remember kind of just growing up with that, like just waiting kind of to figure out what that secret was. And the first time I tried drugs and alcohol, I thought, you know what, that's it. Like it for me, it worked. It became kind of my solution to life. And very unexpectedly so too. It was something that kind of grew up here and don't do drugs. Drugs are bad. And then it was just a lot more readily available than I think that I realized. And what that really allowed me to do was I started to do something, and I describe it as I used to wear just a lot of masks. I really started putting value in the way that everybody thought about me, or, I have to be the best student or the prettiest girl in class. And drugs really were my escape from that, right? It gave me this group of friends, this thing to live for, until it didn't. Right? Until that backfired pretty severely. And kind of fast forwarding 1 year into my use, I was alone and sad and desperate and hopeless, and got to a point that I really never thought I would be. And as a young person, I really was, I didn't know anything about, recovery or sobriety. I kind of had resigned myself to that kind of life. Like this is my life now. And when I was 19 years old, I really started on my journey of recovery. I met these other young people that were my age, and they were happy and they were having fun and they had what I wanted, but they were sober and I didn't understand it. Right. But I did. I fell in love with what they had, and I really wanted that. So I started that journey then. And my journey was a lot of ups and downs. But when I was 22, I entered a recovery community down in Florida, where I lived for a year and a half. And really, when I was there, I encountered recovery through these girls that really loved me back to life, right? They were with me all the time and they guided me and they loved me. And what I was learning is that I could take off these masks and still be okay. And that, I found a lot of purpose in the work that I was doing. And I learned how to be uncomfortable without having to run away from that or escape, and really just encountered freedom for the first time in what felt like a really long time. So moving back home to Forsyth County, I knew that I needed to find a community outside of the community where I'd gotten sober. So that kind of started me on this path with the Forsyth County Drug Awareness Council, falling in love with prevention, right? And it's a long kind of God-centered journey where I found Full Circle. Full Circle is a nonprofit long-term support group for young people and families that struggle with the substance use, mental health, cutting. We have kids here for eating disorders. And it provides that community for them. We have meetings twice a week. We have fun events on the weekends. And it's kind of based off of that whole premise that recovery has to be kind of what Catherine was saying, especially for a young person, it has to be more fun and more fulfilling than whatever the self-destructive behavior they were involved in before. So we provide that for them. And I got to be a part of starting that here in Forsyth County, where I grew up, where I didn't have something like that. And it's been this really incredible journey, and all of this research that's coming out about the benefits of peer-to-peer services and this model, and how the opposite of addiction is connection, is just really, really evident here at Full Circle. You have right now, since we opened last year, we have about 35 young people and families that we serve. And in addition to all the services we offer for free for our young people, we have a parent support group meeting that meets once a week, and also offer one-on-one individual peer counseling with them when they're here. So it's been just this really incredible journey for me to come from a place here of feeling incredibly hopeless, and getting to provide a service that I didn't have when I was growing up, to provide it here in Forsyth County. And I know with the pandemic, it really has exacerbated a lot of the issues we're seeing now with substance use and other kind of addictive behaviors, right? As you heard kind of at the beginning of this presentation. And what I'm seeing just on kind of on the ground floor is that these kids really just are jumping right into the deep end. You know, there's a lot of isolation going on. And so when they're discovering this new tool, like I did, you know, they want to use it all the time. And for me, I really understand that. I've been there. And being a part of Full Circle, it's like, I get it, but maybe there's something better. You know, maybe we can offer you a life that is better than the one that, you know, this behavior you're going through right now. So despite all of the darkness, all of the, in the middle of the pandemic, we've been able to start this program here. In the middle of all of this going on, I am kind of this witness to all of these miracles that are happening every single day. And not a lot of people know that we are here, because we just started last year over the summer. We opened the doors here to what we call the shop, which is a warehouse that we have where kids are able to come. Most of them come after school. The majority of the young people we serve are teenagers, and come here for meetings, for the functions over the weekends, for that individual peer-to-peer counseling. And they're able to be a community of young people that can help each other and support each other on this journey. Because when you're 16 and you're trying not to get high anymore, and you've been doing it for a while, you probably, like I did, you feel like the only 16-year-old that was ever trying to do that. But here you don't have to walk into that. You walk into a community of young people that are really, really supportive of you. And it really has been incredible for me to be a part of. Our services are offered for free. We're new here. We're in downtown Cumming. And normally how we operate is we just invite, you know, we'll say, hey, come to a meeting. Check it out, and we'll, you know, get set some time with your parents. You invite parents to come to our parent support group meeting, see if we're a good fit. And if we are, you know, you have us available anywhere between 1 to 3 years until they end up graduating with a group of their peers, graduating the program. So I have really loved being a part of this. Like I said earlier, the primary demographic that we're serving right now are teenagers, but we have a younger group, ages 13 to 17, and then an older group, ages 18 to 25. And there's a big joke among the staff here that, because a lot of our kids are like younger group girls. And there's this joke, you know, it was because we really did open this. I opened this place for kids like me. And now they're like, well, now you've got 20 of them, which is kind of cool for me to really, to have watched this blossom for a community that I really love. One thing that I would say as far as, you know, strategies for parents watching is I loved what Justine was sharing earlier, is that your kids are watching. Lead by example. I love watching the parent group here support their kids that are coming in here. It's one of the coolest things that I get to see when the kids are talking about what they're learning in their meetings and their parents are sharing that same language. It's a really beautiful dynamic. But they are, they are watching. And another thing too is connection. You're hearing that throughout this whole thing is connection is the opposite of addiction. In order to recover, we need community. We need people that we feel like are in the same boat as us. And whatever you can do to encourage that with your child is incredibly helpful. Full circle, we say, is more preventative in nature than anything else, because you're catching kids a lot of times when they're a lot younger and a lot earlier on in those stages of use and that progression. So they really do. They get connection is incredibly preventative, right? And another thing too, I just want to say to really end this off is don't lose hope. It's been really easy to lose sight of that during this time. I know it because if I turn the news on or I open my news feed, it's filled with stuff like that. But the reality is that there are people getting better, that there is a program that's been born here in Forsyth County in the middle of all of this, and it's grown incredibly quickly, and that I get to watch teenagers who get these principles, get sober, in a place or where they may not have ever had that, right? So don't lose hope. There are so many good things that are still happening here. Our community, like in Forsyth County, we have so many services. We have a community that is really passionate about this. A community that's not burying their head in the sand. And I cannot tell you how big of a gift that is here. It really is because of the effort of people like us that are on this panel, people like you that are tuning into things like this. And don't lose hope. There are really amazing, wonderful miracles happening. I think it's easy for me to say that because I get to see that all the time. It's my job. I, just kind of watching little miracles run around in the warehouse. But it's important not to lose sight of that, not to give up, not to say, maybe if you need help, reach out. There are so many things here, and we're just one of them. But it's been a gift to be able to be here and to share a little bit of my experience and hopefully end this off just with a little bit of encouragement and some more resources for you, especially if you have a young child or a teenager or a young adult that is struggling with things like this, that there are places and people that are equipped to be able to help you and your family. So thank you again for having me on here. And thank you. Yeah.
Thank you so much, Victoria, and to all of our panelists for their very passionate words and presentations. We are now going to enter the Q&A period of our town hall. We're going to be fielding some questions from our live audience in Facebook and YouTube, and then we're going to be asking it to our panelists here. I'll just wait for all of them to come on screen, and then I'll go ahead and start asking some questions. Okay, wonderful. Looks like we have everyone back. So the first question is for Dr. Justine. So you touched on the connection between substance abuse and COVID-19. Do we know what kind of long-term effects can occur from using substances while experiencing an illness such as COVID?
Like Dr. Norton touched on his presentation earlier, there people that use substances, that abuse substances, are higher risk because they tend to have lung disease from smoking, from the use of all these substances. They're likely to have chronic illnesses because of the substance abuse. So when you add COVID-19 to an already damaged body, it will make the chronic outcomes worse. It's logical that it's going to make it worse. If COVID-19, if a healthier person that's never smoked, for example, or vaped gets it, they're likely to recover quicker. They're likely to not have any long-term damage. They're likely to, if they do have some lung damage associated with the acute episode of COVID-19, it's more likely to improve quicker and not leave any chronic conditions or scars. But with everything that's going on right now, everything is so new. The virus is new. We don't know everything about it. We don't know anything about the new strains coming. We even need more data on the vaccines because time will give us all this data that we need. So we just need to let time pass and see exactly what the chronic outcomes are going to be and how different they're going to be. But we are already seeing changes in that people with substance abuse problems are doing worse acutely and chronically, but we'll know even more as time goes by.
Our next question is for Deputy Ferraro. What would you say is the most prevalent drug among teens in Forsyth County?
Great question. And we are right in there with nationwide statistics. Alcohol by far is the most widely abused drug amongst our young people, even here in Forsyth County.
Thank you so much for your response. We'll move on to the next question, which is for Ms. Victoria. What are some of the things that help you and the young people that you serve thrive in recovery in the midst of, this very difficult pandemic?
So there's a lot that I could say there, right? But I think the biggest part for me and for these young people that I'm serving is there's a book that I really like that we use a lot. And one of the quotes from it says, when I focus on the problem increases. But when I focus on the solution increases. So I think like that encouragement piece, that focusing on walking towards something better than what you have instead of just running away from something that you're scared of is huge. When I was 16, I thought I was invincible. You could tell me about the dangers of drugs and I really didn't care. That's how I was, right? I'm not saying that's every 16-year-old, but at least with the young people and the teenagers that I serve, it really is more a draw. I see more of a draw towards, okay, this is more fun. Like this is more fulfilling. This is better than what I had. And so much of the pandemic there's just so much fear and so much despair. And it's really, it's easy to get lost in that, right? So I think that emphasis on empowering one another and connecting in love and community is huge in ways that I can't really describe and I can't really do it justice, right? But the more the emphasis is there on the beauty of recovery and all of that, the more I see them really thriving. And the same is true for me. It can be really easy for me to get lost, and we deal with a lot of really, really dark things here, especially with young people here. I've gone through such hard stuff, right? And for me, I even have to remember that when I'm loving on them, is that let's focus on what's going well. Let's focus on the beauty of what's to come, rather than kind of get lost there. It's so important. And another really cool thing that I have just seen come with the pandemic, and Catherine, you talked about it a little bit too, was that there are just access to different services that people wouldn't have been able to receive another way. So we've been able to utilize virtual meetings with some of our parents that live far away, and maybe their young adults live here. So we've kind of been able to take advantage of even the stuff going on with social distancing or having to shut down the program for a couple of weeks and things like that when it comes to COVID and all of that. That these kids and these families are resourceful. If anything, they're resilient, and we find ways to really because recovery is not this thing that only exists in a non-pandemic world. That's just not true, and they are clear evidence of that. So I guess those are kind of those two things: the resilience of these teenagers and these families. and the emphasis on that. And also just focusing a lot on the hope and what's going right, and the solution is huge. So, yeah.
The next question is for Catherine. How can parents and family best assist their addicted relative with recovery from addiction?
I think you might be on mute.
Thank you. Thank you for that. Actually, a lot of the phone calls that we are getting at the connection come from parents who are concerned. I think it was Dr. Justine who talked about the isolation and being at home, and young people or school-aged people who are actually going through withdrawals at home. And the parents may be seeing for the first time, like, wow, I didn't realize this was such a problem. So we get a lot of calls from parents. I refer a lot of parents to Victoria at Full Circle, but we also have, for parents, a big thing in my experience, and I think in the experience of my family, I can say, was that while the person who is using the drugs may not be ready or willing to step forward, it's still important for the parents themselves to get some support with what they're going through. And so there are parent support meetings available out there. The one large support group for parents that I'm aware of is called the Parent Recovery Network. And I'm happy to connect any parents out there with different resources. There's also some family and friends meetings available virtually. So there are resources for parents just to be in touch with others who are going through similar situations, whether the person who is experiencing the substance use is getting help or not. I think it's important for the family members to do something for themselves.
Thank you so much for your answer. We have another question for Dr. Justine. Is vaping a safer alternative than smoking cigarettes or using marijuana? I think you also might be on mute.
Sorry. Shows my age. Vaping e-liquids is less harmful than smoking traditional cigarettes and using any drug, including, I think people are putting CBD oil in there. And it is not as harmful. It's not safe by any means, but it is less harmful. Vaping e-cigarette juice it still has toxins, it still has carcinogens, still has metal nanoparticles that are all depositing in the lining of your lungs, which is a very delicate lining because it has to allow oxygen to go through. If it was something like the skin, your skin can take a lot. That's why it's outside your body. The lining in your lungs that allows the oxygen to go from the outside into your blood vessels is a very thin, and all these chemicals and particles are just coating it. So it is harmful, but it is safer than traditional cigarettes that has a lot more carcinogens. And of course, the use of any drug.
The next question is for Deputy Ferraro. If I discover that my child is using a substance, what can I do to intervene?
All right. So being in community relations, I'm actually very blessed because I do field a lot of these calls for the sheriff's office. So I want everybody who is viewing this at this town hall today to know that the sheriff's office is a resource. So a lot of the panelists, I'm lucky to call my friends, so I have a big network out here in the community, working in the community for 14 years. And through that network, we could provide a whole load of services. I do personally go out and usually start the conversation between the parent and their child. We have a program here in the sheriff's office called the Teen Interception Program, not specific to drug use, but I want you to know a high part of the membership of that class are kids who started experimenting with drugs. And again, we talk about all the consequences. So it's reality. My end game is not to arrest young people. That's the last thing that I want to do. We want to get them the resources to be successful. So that's what I would put out there in reference to that question.
Thank you for that great response. We have a question for Dr. Norton. Do you have any insight on how COVID-19 will impact the future of substance abuse prevention?
That's a great question. Unfortunately, I don't think it's going to be beneficial for the next 12 months. The fear of the individuals from the standpoint of contracting the disease keeps many people, and what I've discovered, having been in the treatment industry for the last 25 plus years, but the last 2 years especially, with COVID-19 hitting us, it's another alibi for a lot of people not to access treatment. I'm very happy to see Catherine and Victoria and others like them be able to provide coaching and events that can then encourage people to understand what it is if you go to treatment and what treatment is about. And it's not this nemesis out here that somebody's going to do something terrible to you. But unless we do, the thing that I think is most beneficial is what we're doing here today is to educate people to understand what is here and how we can do it. Going to treatment is a process, y'all. I don't care what the disease is. I don't care if it's a cancer or diabetes or blood pressure or any other chronic disease. People have to be educated to understand, one, what is the disease, and then what are the steps they do to help manage that disease once it's diagnosed. And COVID-19 has really put a big block of resistance from the standpoint of fear. But I think it will get better. I'm encouraged by the vaccinations that are occurring. I'm encouraged by the people that are looking at vaccinations. And I think it's an opportunity to improve. And I think, in fact, what I'm hearing from a lot of the mental health specialists out here, the mental health capabilities have actually improved greatly from assessment and also the interactions of people, if it be virtual or if it be face-to-face. So I will tell you that on the back end of this, I think it will be better. But in the near future, I don't know that it's going to improve any drastically from my point of view anyway. Great question, though. Very good.
The next question is for Catherine. What are resources for individuals impacted by the mental health challenges caused by the pandemic?
Unmute myself. Hey. Some resources available for people impacted by mental health challenges question. As Deputy Ferraro says, we have a very large network of support. I know that in terms of peer supports, that's available, as I said, through the connection for individual coaching. We also have CSB. We have a mental health clinic here that we can make referrals to. We have a whole host of referral systems for, like, I know that we cross-refer all the time. I might call Deputy Ferraro and say, I have a situation. Do you know someone who might work with a child? So the main thing is, I think, to encourage to reach out to someone. And if I don't have all the resources, I probably know someone who does. So if there are a lot of resources available in our county. It just may not be, there's not one place, I guess, who can serve everyone, but there are a lot of places who can serve everyone. The main thing is to reach out and ask.
Thank you so much. We have a question for Victoria. If you had anything that you would like to say to struggling families or for people that are in recovery that may be struggling with the pandemic and social isolation, what would it be?
Well, I'd probably say a couple things. One is growing up here. I know we've talked a little bit about stigma, but I I know how prevalent that is here. Like I really do, because I lived here my whole life, and or the majority of my life. So despite that, what I would say is reach out anyway. You know, what I have found is kind of on the flip side of that stigma. It really was, you know, I found my people. They exist, like we exist, you know, and that is a barrier worth pushing through, because there's so much goodness and so much good stuff on the other side of that. But I know how scary that is. But just to say that there are people that are in it with you. So to do it anyway, because we're here, you know. And then I know I've said it so many times, but really, I want to offer hope. You know, I really want to offer encouragement, because, like what Catherine just said, if you know, like there's so much here, and I didn't really even know about it until I started getting involved in this world, right? Until I really took a step in and met all of these people here, and there really is so much. So to know that there is going to be a community that rallies around you, I really don't see that many places like I do here. We really take care of each other, and it's beautiful and special. So I say, yeah, don't lose hope. Reach out anyway. You're not alone. And yeah, that would be it.
And the next question is to Dr. Justine. Has the pandemic increased the difficulty associated with responding to drug overdoses?
Yes, absolutely. It has. And because of the reasons, you know, we've all spoken about having to, you know, social distance, stay home from work, do things virtually. So what we need to do is find out ways to overcome that in the future. We need to learn. This was a fire drill for us. And we need to find ways to keep going, but still be able to follow public health measures that are going to keep future pandemics at bay. And let's learn from this, and let's find ways. Humans are so resilient, and we can do anything when we get together and we put our minds together and we work as a community. We built pyramids. We've done it all. We're here today. We did this vaccine in a year. So working together, we need to find ways to have access to these services available during pandemics, because it will come. So we all need to know that and work together to find ways to for us to keep working and keep giving the help that is needed.
Thank you so much for that answer, Dr. Justine. And this might be the final question that we ask in our Q&A period, and it goes to Deputy Ferraro. What are some of the outreach programs that the Sheriff's Department is conducting to support our community during the pandemic?
Great. So again, during the pandemic, it's changed our in-person. Unfortunately, we're not doing a lot of in-person meetings. So we had to adapt and overcome, just like everyone else, how they've been talking about going virtual meetings. So we've been doing our outreach using Zoom or WebEx, still reaching our target audience. Unfortunately, again, contrary to what I've been hearing in reference to the attendance on our virtual meetings, it's been a lot less than what we were doing providing in person, especially amongst our senior group. We work closely with senior services. However, we do continue to move on. And as Dr. Justine just explained, this being basically our first run at it, learning to adapt, I do believe future-wise, this will give us the opportunity to have a broader audience and reach more people in reference to our outreach, regardless of what program it is, doing, which we started right now, half in person and half virtual. So we still offer all of the programs that we did pre-pandemic. We just do them on a request basis, whereas in the past, we used to do it every single month. So trying to keep our resources utilized accordingly.
Fantastic. Thank you so much. And with that final question, we're going to start concluding this event. I want to reiterate our gratitude for all of these excellent speakers for sacrificing time out of their busy schedules to come and contribute to this town hall. I hope for those in the audience that through the course of this event, that you are able to learn more about substance abuse and hopefully receive some insight as to how to address this crisis on wherever it may impact you. As Victoria said, we constantly hear in the media a lot of bad news, but there's definitely hope out there. This is a tough time for all of us, but if we can unite and work together, we can definitely create positive change in our community.
Before leaving, if everyone could just fill out the survey that's in the chat and will be in a QR code up on the screen. It's really short and probably only takes 5 minutes, and it would really help us hear your feedback on this event. And once again, thank you all for coming.